Welcome back. A team of 6 doctors from Ukraine is wrapping up a month-long visit to Yale New Haven Hospital in the Yale School of Medicine. Their visit was made possible by the Doctors United for Ukraine program. Yale obstetrician gynecologist Dr. Alla Vash-Margita is one of the coordinators of the program. She's joining us this morning, along with 2 of the Ukrainian doctors, Dr. Yevgenia Polakova, an obstetrician and gynecologist, and Dr. Daria Bazelenko, who specializes in anesthesiology and intensive care. Thank you all for being with us this morning.
Thank you.
It's a pleasure to be here.
Dr. Vash-Margita, I want to start with you. Take us through this from the Yale perspective. What's this program designed to do? Why did you invite these folks over from Ukraine, and how does it work?
So, needless to say that there is a relentless war happening in Ukraine that was unprovoked since February 2022. We as physicians at Yale New Haven Hospital wanted to help, and we started by delivering vital supplies to Ukrainian hospitals. But as we were talking and communicating with our physicians, we realized that supplies is one thing, but what we could do best is deliver knowledge. And that led to formation of something called Scholars at Risk of Ukraine. This program was supported by Yale Macmillan Center, Yale Dwight Hall for Social Justice, Yale New Haven Hospital, and Yale University School of Medicine. We were able to secure funding to bring 6 physicians, 4 anesthesia, critical care doctors, and 2 obstetricians, gynecologists to Yale New Haven Hospital to learn and observe different skills and knowledge and practices that are sort of routine here, but maybe novel and very useful Ukrainian hospitals and our colleagues.
So, Doctors Polakova and Bazelenko, I'm going to start with you, Dr. Polakova. You've been here for a month. You're getting ready to go back home. What has this program meant to you? What have you gotten out of it?
It is very. I think that there are a lot of things that I will grab from here to use them back at home. There are a lot of knowledge that we can use at home. I think the main aspect that impressed me most, it's like the organization of medical care here in the United States. The United States of America had a very different healthcare system than the Ukrainian one, but here in the United States, with the help of the dedicated physicians and just supportive staff, they can provide qualified assistance to a large number of women. And in Ukraine, where we have significant brain drain to another countries of our doctors, I think it's like crucial for us. Another thing is like rational use of antibiotics here. It is crucial for 2 main reasons. It's reduced the antibiotic resistance, and it's important for the whole world, and it helps the institution to save money. In Zaporizhia, I'm originally from Zaporizhia, rather big city, but like 20 miles away from the front line, from the occupied territories. It is very important, will be for us.
And Dr. Bazelenko, I want to turn to you. You come here from a country that is in the middle of a war. What has this experience been like from you leaving home while that conflict rages on back home?
Well, it's hard to explain how it was to be there and how this new experience will implement in our home. So during war,
it strikes me that you're coming from a place where there's a war, but you're focusing on things like anesthesia and obstetrics and gynecology and helping women. I mean, I heard that there was a maternity ward that had to be moved into a basement because of bombing. When that kind of stuff happens, how do you take this knowledge and go back home and use it, Dr. Bazelenko?
Well, exactly. I'm working in cardiac surgery center, so for me it's a little bit different. We deal with combat-related trauma, such as foreign bodies in hearts and lungs. These patients are very complex because they had related trauma also, such as abdominal, head traumas, and so on. Here at Yale, I have seen a lot of stuff that I can implement in home. For example, pain control management, using different blocks and different kinds of regional anesthesia. Also, how to preserve blood components, how to reduce infection after surgery, and in general, how teams work together for a complex patient.
Dr. Vash-Margita, I want to ask you about this because obviously they just said so many things that they're going to take home, whether it's just seeing how you do things here, maybe even some new procedures or treatments they could try. But did the doctors here get something out of this as well?
So yes, and that is the beauty of this program. And I say teaching and learning goes both ways. Physicians that we invited here are licensed and brilliant physicians who've been in practice for some time. So we've been talking to critical care doctors here and surgeons at Yale. They actually, our doctors said at this point, there's lots of knowledge that they can learn from critical care doctors and surgeons in Ukraine, just based on the amount of trauma and type of trauma they witnessed and treated in Ukraine. So teaching goes both ways. We don't need to teach Dr. Vasylenko or Dr. Polyakova how to deliver a baby or how to administer anesthesia, but it's more about systematic improvement on a large healthcare system, how to organize protocols, implement evidence-based medicine, and that is what doctors will bring back home.
Dr. Polyakova, I want to ask you, now that you've had the chance to see it, I know a lot of people who live here in Connecticut say being so close to an institution like Yale or any of the great medical centers in the Northeast, we're lucky to be where we are. As you see it and you see how things are at Yale, have you been impressed with what the American doctors are doing?
Yes, I've been absolutely impressed. In Ukraine, we don't have, like many big cities in Ukraine, even like our capital in Ukraine, we lack specialized center for fetal medicine. And here in Yale, I was really impressed with the procedure they are doing. It's absolutely amazing. So I think that when I will be back home, we will absolutely start doing this with our babies. Maybe in the basements, but it is not important.
And Dr. Vasylenko, I have a few seconds left, but are you going to miss being in Connecticut, or are you ready to go home?
Well, that's a complex question because I love it here, but I won't go home too because I have so many knowledges that I would like to share with my colleagues, and I have to do this, and I have to go home, and I would love to be home also.
Well, we wish you safe travels as you head home. We appreciate all of you being with us. Dr. Dario Vasylenko, Dr. Yevgenia Polyakova, and your host, Dr. Alla Vash-Margita. Thank you all for being with us. I know this was a pilot program, so maybe we'll cover it in the future if more Ukrainian doctors come back. Thank you all for being with us here on CT23.
Thank you.